At Friday prayers, old rituals have been joined by new ones. A belief in social distancing and masks to keep them safe. This congregation has already lost 150 members to COVID this year. Back in April, the mosque built a temporary mortuary in its car park. There are now plans to do so again, with fears the death toll could be even greater this winter.
I think this time it's going to smack us and smack us really hard.
Why?
Because people are careless, people are lethargic, people are thinking it's not going to happen to them. It didn't happen last time, why should it happen this time?
Those parts of Birmingham served by the mosque already have some of this city's highest infection rates. And once again, a disproportionately large number of people from ethnic minorities are ending up in intensive care. We know the reasons why are complex and vary in each community. Among them are poor housing, racism and decades of health inequality. But despite a government report making recommendations in June, many people say little has been done about it.
He got ill on a Thursday and he passed away within a week, and it is quite brutal.
Maqbul Ahmed caught the virus at the same time as younger family members he lived with. His son says the government still isn't reaching people.
Diversity isn't about colour of skin. Diversity is about people live very different lives and understand what that means. You know, you can be in a household with an 84-year-old all the way down to an 18-year-old. You've got to message all of those people differently.
This senior doctor says the government hasn't learned the lessons of the spring.
We have heard nothing in terms of any actions or plans that will protect our community. And now that we are entering a second wave, we're beginning to see the repetition of what happened first time round.
But some local authorities have been praised for being proactive.
It doesn't take 2 minutes, it's a swab on the back of the throat.
In Birmingham, there's door-to-door testing in the worst affected areas, and the inequalities are at least being talked about.
Listening must have some action. So this isn't a sporadic intervention where we all hold flags up and say we're with you and, you know, Black Lives Matter, look, wasn't that terrible? This needs coordinated, strategic action.
Despite the worrying trends in intensive care, the government says it is taking forward vital work to tackle disparities, putting in place measures like targeted testing and translations of guidelines. But here there is little faith that things will be significantly better second time around. Ben Chapman, News at 10, Birmingham.